What if your body tried to warn you weeks before a heart attack, but you didn't recognize the signs? Most people believe heart attacks happen suddenly, out of nowhere. One moment everything is normal, and the next moment everything changes. But that's not always true. In many cases, your body starts sending signals days, even weeks in advance. The problem is, those signals don't look dangerous. They feel small, easy to ignore, easy to explain away. A little fatigue, a slight discomfort, a change in breathing. Nothing that makes you stop and think, this could be serious. So most people do what feels natural. They ignore it. They blame stress. They blame age. They tell themselves, I'll be fine. And that's where the real danger begins. Because what looks like a minor issue can actually be your body warning you that something deeper is going wrong. Now here's the important part. These warning signs don't always feel like pain. They can appear in unexpected ways. In your chest, your arms, your breathing, even your energy levels. And because they don't match what people expect, they get overlooked. Now think about this. If your body was giving you signals 1 month before something serious, would you recognize them or would you miss them completely? Because by the time a heart attack happens, the process has often been building for a long time, quietly, silently. And in many cases, there were warning signs. They were just ignored. In this video, you're going to discover 5 warning signs your body may give weeks before a heart attack. You'll learn what to look for, why these signs happen, and how to take them seriously before it's too late. Because when it comes to your heart, early awareness can make all the difference. And sometimes, the signs are there. You just need to know how to see them. Now let's start by understanding something very important. Heart attacks do not usually happen suddenly. They may feel sudden, but in many cases, they're the result of a process that has been developing for a long time. Days, weeks, sometimes even months. Now here's the problem. Most people only think about a heart attack when they imagine severe chest pain, something dramatic, something obvious. But your body doesn't always work that way. In fact, before a major event happens, your body often sends subtle signals, small changes, nothing that feels urgent, nothing that forces you to stop. And that's exactly why they are missed. Now think about this. Have you ever felt more tired than usual without a clear reason? Have you noticed your energy dropping even though your routine hasn't changed? Have you experienced slight discomfort that comes and goes? Most people don't think much of it. They assume it's just stress, it's just aging, and they move on. But sometimes, those small changes are not random. They are signals. Now here's something very important to understand. Your heart does not fail overnight. Before something serious happens, your body goes through a period of stress. Your blood vessels may become narrowed. Your heart may have to work harder. Your circulation may become less efficient. And during this time, your body tries to adapt. It tries to compensate. But those changes can start to show in subtle ways. Now imagine this. Your heart is not receiving enough oxygen. Not completely blocked. Not severe enough to cause immediate pain, but enough to create strain. What happens? You may feel more tired because your body is not getting the energy it needs efficiently. You may feel short of breath because your heart and lungs are working harder together. You may notice unusual sensations, but they don't feel serious. Now here's the key idea. These early signs are often mild. They don't match what people expect from a heart problem. And that's why they are ignored. Because people are waiting for something obvious, something that clearly feels dangerous. But by the time symptoms become obvious, the situation is often more advanced. Now think about this. If your body was giving you signals early, would you recognize them? Or would you wait until it becomes impossible to ignore? Because this is what happens most of the time. People wait. They continue their routine. They delay taking action. Until one day, the situation becomes serious. And then it feels sudden. But it wasn't sudden. It was building, quietly. Now here's something that doctors see again and again. Patients often report that before a heart attack, they just didn't feel right. Not sick, not in pain, just different. A change in energy, a change in comfort, a change they couldn't fully explain. And because it wasn't clear, they ignored it. Now this is where awareness becomes important, because recognizing early signs can change everything. It gives you time to check, time to act, time to prevent something serious. Now here's the key takeaway from this part. Heart attacks are not always sudden events. They are often the result of gradual changes that your body signals in subtle ways. And those signals are easy to miss. Not because they are not there, but because they don't feel urgent. Now imagine this. Instead of ignoring those small changes, you pay attention. You notice patterns. You take them seriously. That simple shift can make a huge difference, because early awareness is always more powerful than late reaction. In the next part, we're going to look at the first warning sign, one of the most commonly ignored signals that can appear weeks before a heart attack. And once you understand it, you may start noticing things you never paid attention to before. Now let's move to the first warning sign, because this is one of the most common and one of the most ignored: unusual fatigue. Now this may sound simple, because everyone feels tired sometimes. You may think, I didn't sleep well, I've been busy, and that makes it easy to ignore. But this kind of fatigue is different. It doesn't feel normal. It feels deeper, more persistent, and sometimes it appears without a clear reason. Now here's the important part. This is not just about feeling tired after activity. This is about feeling drained, even when you haven't done much. Now think about this. You wake up in the morning, and instead of feeling rested, you already feel low on energy. You go through simple tasks, and they feel heavier than usual. Things that never used to tire you start to feel more difficult, and you can't fully explain why. Now here's what may be happening inside your body. Your heart may not be pumping as efficiently as it should, not enough to cause severe symptoms, but enough to reduce how well oxygen is delivered to your muscles and tissues. And when your body doesn't receive enough oxygen efficiently, your energy drops. Now imagine this. Your body is working harder just to maintain normal function. Even small activities require more effort, and that creates fatigue. Now here's the key detail. This fatigue is often gradual. It builds over time, day by day, week by week. And because it develops slowly, your brain adjusts to it. What once felt unusual starts to feel normal. Now think about that. If your energy slowly decreases over weeks, you may not notice the change clearly. You just accept it. You adapt to it. And that's exactly why this warning sign is missed. Because it doesn't feel sudden. It doesn't feel dangerous. Now here's something very important. This type of fatigue is often persistent. It doesn't go away easily, even after rest, even after sleep. You may feel slightly better, but not fully refreshed. And that's a key difference. Now imagine this. You rest, but your energy doesn't fully return. That's your body telling you something. Now, here's another important point. This fatigue may appear weeks before a serious event. Not days, not hours, weeks. And during that time, your body is trying to cope, trying to function, but sending signals at the same time. Now here's what most people do. They ignore it. They push through it. They assume it's normal. And they delay paying attention. Now think about this. If your body is showing you a change in energy without a clear reason, should that be ignored or should it be noticed? Because energy is one of the most basic signals your body gives you. When something is not right, your energy is often affected first. Now here's the key idea. This is not about panic. It's about awareness. Because fatigue alone does not mean something serious is happening. But when it is unusual, persistent, and different from your normal state, it is something you should not ignore. Now take a moment and ask yourself, has your energy changed recently? Not dramatically, but gradually, because that's how this signal often appears. Slow, subtle. Now let's summarize this warning sign. Warning sign 1. Unusual fatigue, feels deeper than normal, appears without clear reason, builds gradually, does not fully improve with rest, often ignored. Simple, but very important. In the next part, we're going to look at another warning sign, one that many people confuse with something harmless, but one that can be a signal your heart is under stress. And once you understand it, you may start noticing patterns you never paid attention to before. Now let's move to the second warning sign, because this is another signal that many people completely overlook: shortness of breath. Now most people associate this with activity, climbing stairs, walking fast, doing something physical. And in those situations, it feels normal. But this is different. This is when you start to feel breathless during activities that never used to affect you. Simple movements, walking a short distance, doing light tasks, even moving around the house. And suddenly, you feel like you need to pause to catch your breath. Now here's the important part. This doesn't always happen suddenly. It develops gradually. At first, it may be very mild. You notice it once, then you forget about it. But over time, it starts to happen more often. Now think about this. Something that never used to feel difficult is now requiring more effort, and you don't fully understand why. Now here's what may be happening inside your body. Your heart and lungs work together to supply oxygen to your body. When your heart is functioning properly, this process is smooth. But when your heart is under stress, it may not pump as efficiently. And when that happens, your body receives less oxygen during activity. Now imagine this. Your muscles need oxygen to function. If they don't get enough, they signal your body to slow down. And that's when you feel breathless. Now here's something important. This type of breathlessness may not feel severe. It may just feel unusual, slightly uncomfortable, but not enough to alarm you. And that's exactly why it gets ignored. Because people expect something dramatic, something obvious, but instead they get something subtle. Now here's another key point. This symptom is often inconsistent. Some days you notice it, some days you don't. And that makes it even easier to ignore. You tell yourself, maybe I'm just tired, maybe I didn't sleep well, and you move on. But over time, the pattern becomes clearer. Now think about this. If your breathing changes, even slightly, without a clear reason, that is something your body is signaling. Because breathing is automatic. It doesn't change randomly. Now here's something very important. This symptom can appear weeks before a serious event. It doesn't mean something immediate is about to happen, but it does mean your body is under strain. Now imagine this. Your heart is working harder to keep up. Your lungs are compensating, and your body is trying to maintain balance. But that effort creates subtle signs, like shortness of breath. Now here's what most people do. They adjust their behavior. They walk slower. They avoid certain activities without realizing why. And over time, their world becomes smaller because they are adapting to a problem they don't understand. Now here's the key idea. Shortness of breath is not always just about fitness. It can be a signal that your body is not getting what it needs. Now take a moment and ask yourself, have you noticed any change in your breathing? Not extreme, but subtle, because that's how it often starts. Now let's summarize this warning sign. Warning sign 2. Shortness of breath appears during normal activity, builds gradually, feels mild at first, often inconsistent, easy to ignore. Simple, but important. In the next part, we're going to look at another warning sign, one that many people completely misunderstand, because it doesn't always appear where you expect it. And once you understand it, you may start paying attention to signals you've ignored before. Now let's move to the next warning sign, because this is one that many people misunderstand. Unusual discomfort in the chest or upper body. Now when people think of a heart problem, they imagine intense chest pain, something sharp, something sudden. But in many cases, that's not how it starts. The feeling can be mild, a pressure, a tightness, a discomfort that comes and goes. Sometimes it's not even in the chest. It can appear in the shoulders, the arms, the neck, even the jaw. And because it doesn't match expectations, people ignore it. They think it's just muscle strain, it's just a minor issue, and they move on. Now here's what may be happening. Your heart may not be receiving enough oxygen, not a complete blockage, but enough to create strain, and that strain can create these sensations. Now here's the key detail. This discomfort is often temporary. It comes and then it goes, and that makes it easy to dismiss. But recurring discomfort, even if mild, is something you should not ignore. Now let's move to the fourth warning sign, unusual sweating. Now sweating is normal, but this is different. This can happen without physical activity, without heat. You may suddenly feel sweaty, even while resting, and it may feel unusual, not like normal sweating. Now here's why this matters. Your body may be under stress. Your nervous system may be reacting to changes happening internally, and this can trigger sweating. Now again, this symptom may appear subtle. It may not happen often, and that's why it gets ignored. Now let's move to the fifth warning sign, a general feeling that something is not right. This may sound vague, but it is very real. Many people report this feeling before a serious event. They don't feel pain, they don't feel sick, but they feel different. Something feels off, and they can't fully explain it. Now here's the important part. Your body is very good at sensing change, even before your mind understands it. And sometimes, that internal awareness is a signal. But because it's not clear, people ignore it. They wait for something more obvious. Now think about everything you've learned. Unusual fatigue, shortness of breath, discomfort in the upper body, unusual sweating, a general feeling that something is not right. None of these may feel serious on their own, but together they form a pattern. A pattern your body may be showing you weeks before a heart attack. Now here's the key idea. Your body often gives signals early. Not loud, not dramatic, but real. And when you ignore them, you lose the opportunity to act early. Now imagine this. Instead of ignoring these signs, you recognize them. You take them seriously. You seek advice. you get checked. That simple decision can change everything, because early action can prevent serious outcomes. Now, here's something very important to understand. This is not about fear, it's about awareness, because not every symptom means something serious. But ignoring signals completely is where risk increases. Now take a moment and ask yourself, have you noticed any of these signs? Even mildly? Even occasionally? Because awareness begins with noticing. Now let's bring everything together. Heart attacks are often not sudden. They are the result of a process that builds over time. And during that time, your body may be giving you signals that are easy to miss. But once you understand them, you see them differently. Now here's the final takeaway. Do not wait for something obvious. Do not wait for something severe. Pay attention to small changes, because small signals can point to bigger problems. And when you act early, you give yourself the best chance to stay safe. Because when it comes to your heart, awareness is not optional. It is essential. And the best time to listen to your body is before it forces you to.